I think certain procedures lend themselves extremely well to robotic surgery, and I mentioned before robotic prostatectomies, robotic partial nephrectomies, robotic kidney surgery. Anything that's in the pelvic region is a wonderful tool to be used for robotically. What's happening is because it's become such a popular technology, the companies have obviously been pushing it, the patients are demanding it, so I think it's being used probably in other cases where it probably shouldn't be used, or it's being overused, and there's maybe not a major reason to use it. Again, as the technology becomes cheaper, as it becomes more ubiquitous, and our efficiencies get better, it'll sort of even itself out. I liken this a little bit to what laparoscopic surgery was about 20, 30 years ago, where it was extremely expensive, the equipment was expensive, the surgeons, the open surgeons at the time were sort of bad-mouthing the idea of using laparoscopic surgery. Now laparoscopic surgery has been proven the test of time that it's cheaper, it's faster, patients go home earlier. And I think robotic surgery is not far behind. Again, it takes several, at least 10 to 20 years of sort of data to prove that. And I think we're just at the cusp of where we're going to start to see that as well. Definitely, there's still many cases where it doesn't make sense to do these robotically, although I think that we're seeing as surgeons get more and more comfortable with this technology and have been doing it for many years now, we're seeing less and less of a reason for people to do open surgery. But where I think open surgery still has a major role is when people have had multiple surgeries, or there's a lot of adhesions and scar tissue, or for instance, we're dealing with large tumors where it doesn't make sense to do it through small incisions, since you're going to have to make a very large incision to remove the mass as well. It's really a safety issue and a comfort level of the surgeon. But again, like I said, over the years, I think we're seeing fewer and fewer of those reasons for conversion, or even for just proceeding directly with an open procedure. I think a lot of those fears have been alleviated over the years. There was definitely some negative press about robotic surgery a few years ago, front cover of the New York Times and some other major lay press papers. A lot of that had to do with the comfort levels and the experience of the surgeons. And again, we have to remember, it's a tool like anything else. And a tool can be misused, just like a scalpel can be misused, a car can be misused. So a robot can also be misused, especially if the surgeon, for instance, is using it at a time when he or she is not comfortable using it or has not been trained properly. I think a lot of those issues have been resolved simply because now it's become so commonplace. So most patients, at least my patients, come to see me see me because I'm doing robotic surgery, not because they're worried about it. I rarely get the question anymore, well, I'd prefer to do this open, or I prefer to do this laparoscopically. Robot surgery has really become a mainstay for us. I got attracted to doing urology simply because it was a field that had a lot of technology and gadgets involved. I guess being a male, I was interested in that, and so it followed me into my career. What I'm a little surprised about is that the technology is not a little bit further, and that may be partly that may be having to do with sort of the marketing and the inability for competition to come in. So there's in particular companies that are sort of doing robotic surgery or making the robotic surgery equipment and don't really have competition right now. That will probably change in the next 5 to 10 years, and I think we're going to see a whole slew of new sort of techniques and types of technologies that are coming out, much the same way that laparoscopic surgery had multiple players and multiple companies making equipment for laparoscopic surgery. It brought down the price, it increased innovation, it increased the ability to sort of do some more interesting and more complicated types of procedures. And I have a feeling we're going to see something similar when it comes to robotic surgery. The biggest challenge for us as surgeons and as physicians is the cost, sort of financial constraints. As the hospital and the physicians and obviously the patients are sort of contending with what gets paid for and what doesn't get paid for, we have to also contend with how we can introduce really sort of high-tech technology that's expensive and really is going to sort of make a mark on the healthcare system. Robotic surgery is certainly no exception to that. It's an expensive piece of technology. It's taken a lot of time and effort to get it to where it's becoming safe and efficient and can be used with patients without as a commonplace or even standard of care. So I think that's going to be our biggest problem as we get further along with this is trying to figure out who's going to pay for it, how it's going to be paid for, and who's going to ultimately pick up the cost. Is it going to be the healthcare system? Is it going to be the patients individually? Are the hospitals going to have to start worrying about this? So that's my biggest concern, to be honest. I think it becomes tougher and tougher to be a surgeon and to actually deliver health care when you're constantly thinking about who's going to be picking up the bill for your patients. It depends on who you poll, but the Affordable Care Act, I would hardly say is containing costs. If anything, I think it's highlighting certain costs that are becoming more expensive. The health care is basically a pie, and there's a finite number of dollars that goes into that pie, and every year it's just carved up differently. And so the question is, who gets what piece at the end of the year? The field of urology, I think, is definitely a misconception about what we do and what's actually involved in urology. Obviously, growing up, if someone had told me that I was going to be a urologist, I don't think I would have believed them. But urology is an interesting field. It is a surgical field. It is a medical field. I have patients that see me on a regular basis. I get to work with sort of the high-tech, interesting kind of surgical equipment that no other field gets to do. We really are sort of in the forefront of new innovative products and new technologies. I actually have several patents in surgical devices as well, so it kind of puts me in an environment that allows me to sort of experiment and try out new things, and that's what I love about it. I work in a wonderful institution. I love what I do. I'm also at the center of healthcare, tertiary healthcare. We have people from all around the world who come seek out their care. And so, it's basically a dream job in that regard. I get to meet interesting people. I have very interesting cases in a teaching environment with residents and students. And so every day, even though I'm teaching, I'm constantly still a student, which is great. So I wouldn't change my job for anything right now.